All right. Good evening, everyone, and welcome to ATP Live Monday. All right. Good evening. Welcome to ATP Live Monday. I am Gbemisola Boyede, and I'm here to answer any questions that you may have about the health of your children on our program ATP Live Monday, brought to you by Ask the Pediatricians Foundation. As you're all aware, at Ask the Pediatricians Foundation, we are committed to the health and welfare of all children globally, but especially in Nigeria and sub-Saharan Africa, where a lot of our children are still dying from preventable causes. So, welcome everyone, and let us just share the links and the videos so that everybody can join us. But for those of us who are here already, if you have any questions, whether you're on Instagram, on Facebook, on YouTube, feel free to drop your questions, and I'm going to spend the next 60 minutes answering them. But I'm just going to take a minute just for share the video so that everybody can see and everybody can hear us. So, all right. So, welcome everyone. I hope you've had a lovely, lovely, lovely day. Um, so, welcome. Thank you so much, Shukurat Abu Bakri. Thank you so much. Uh, Feel free to also share the video with me. Share it to every platform where you have opportunity to share videos so that they can join us and have opportunities to also learn. Okay, I think I'm done with my sharing. And then I think before I do that, welcome everyone. Instagram people, welcome. Feel free to share the video. Feel free to invite your friends and families to join us. And we got 60 minutes to answer the questions. But just for you to know that even after the live session, you can always post your questions directly on our Facebook group, Mondays to Saturdays, and we'll be there to answer your questions. All right, welcome everyone. Oh, thank you, Chukuraj, for sharing. I can see that you've done the sharing. Uh, okay, I just think I need to just pin them now, and after that will be good. Okay, so just do the pin posts. Okay, and then let me just also pin in the groups, and then we are good to go. But feel free, those who are here already, feel free to start um, dropping your questions, and we will start to answer them. Um, we're almost at the end of February. I mean, that's amazing. I mean, the year is just running so fast. Amazing, amazing. Okay, yeah, I think I'm done with all the sharing and all the pinning. Okay, I guess I'm good. All right, so good evening once again, everyone. Welcome to ATP Live Monday. I am Gbemisola Boyede. I'm a pediatrician, and it's my pleasure to be here most Mondays to answer any question you may have about the health of your children live. Program is brought to you by Ask the Pediatricians Foundation, but beyond what we do online, which also include, apart from this program, our Facebook groups where you can ask any questions about the health of your children Mondays to Saturday. We also do community medical outreaches in almost all the states of Nigeria, in schools. Our goal, our vision is to see that no child dies from things that we can prevent and from things that we can treat. So this is why we are here. And thank you so much for those of you who have been watching our videos, sharing our reels. Please keep on sharing, keep on following, let us all keep learning together so that our children will live another. So thank you so much. If you are watching on Facebook page, Instagram, YouTube, just drop your question directly under the comments and I will see them. If you're watching our groups, you have to click. If you have a question, you have to click on the video so I can see your comment. But if you don't have any question, you are free to just keep watching just where you have. All right, so I think I have a question already from Shukrat Abubakri. I hope I'm pronouncing your name. Okay, so you said what makes a 4-month-old baby to have a pink patch on his diaper? Okay, I don't know whether you were the one that was asking this question on our Facebook group. Unfortunately, we don't post pictures of diapers or nappies on the group. There are some pictures that are not in line with our community guidelines and practices. Nappies is one of them. So that is why we couldn't approve it. But the commonest cause of this pink stain or sometimes orange stain in babies' nappies is usually what we call urate crystals. Urate crystals, urate is like one of the end products of some digestion in the body and all that gets passed into the urine, okay? And so sometimes if the urine is very concentrated like this, that the urine is really so especially for example a child who is dehydrated, you may have the crystals, it will crystallize and it will give that pink or orange color to the nappies. So it's nothing to worry about. What we just recommend is that parents keep on for a 4-month-old, you keep breastfeeding them frequently so that they are not dehydrated, but it's nothing to worry about. The most important thing to differentiate it from is blood, because we don't want blood at all in the urine. We don't mind urate crystals, but we don't want urine. So, and from what you're saying now, your child have fewer pee, exactly. That means your child's urine is concentrated. That means your child is a little bit dehydrated, and I don't know how you're feeding your baby. What we recommend is that you give your baby breast milk only. We don't recommend giving water, okay, unless you are doing mixed feeding. But if you are doing exclusive breastfeeding, just breastfeed your baby only. Your baby does not need any multivitamins. I don't know which doctor you saw. I have a feeling you didn't see a pediatrician, because if you see a pediatrician, they will know exactly that this is urate crystals. It's nothing to worry about. All you need to do is to make sure your child is breastfeeding frequently, and especially during, if you are living in an area where the weather is hot, so that may also explain the body is also trying to conserve water, because your child may be losing a lot of water from sweating and all that. So if the baby is losing a lot of water from sweating, then the body tries to conserve the water in urine, so less urine will be passed. But what you need to do is to make sure you're breastfeeding frequently. So we expect a 4-month-old baby to be on exclusive breastfeeding, and so we expect you to keep breastfeeding more frequently. We don't want you to give water. Breast milk is 70% water. So if you want, you can take you can express your breast milk, put it in a clear bottle, stand it for maybe a day. You will see it differentiate into the milk residue and the clear water at the top. So there's enough water in your breast milk. Even if you live in the northern part of the country, even if you live in places that the weather could be quite hot, you still have enough breast milk and enough water in your breast milk to keep your baby well hydrated. So no matter what, we don't recommend giving water to babies even if they are dehydrated. What we still recommend is that you breastfeed the babies, and you breastfeed more frequently, because the water in the breast milk is enough for your baby. It has enough water. When you give water and you're breastfeeding, you are actually diluting the breast milk. And what that means is that the calories that your child will get from the breast milk will be reduced. The tummy of the baby will be filled with water and not calories. And that baby may start to lose weight, would fail to thrive. And so we don't want that. So, but we know that if you give the breast milk alone and you do it more frequently, your baby will get enough calories and your baby will still get enough water and your baby will be well hydrated. So we don't recommend water for babies who are on breast milk. We recommend that you give them breast milk only. So I hope that is clear, and your baby does not need any multivitamins or any other drugs for this particular question. And when your baby is 6 months old, then you can start complementary feeding. And when you start complementary feeding, that is when you can now give water to the baby. I hope that is helpful. All right, let me just check on Instagram. Good evening, Major Evans. Good evening, Champagne. Good evening, Nafse, the introverts, Unique Kid Space. Everybody on Instagram, Lorita Molo, the rest of you, thank you so much for joining. Feel free to ask any question that you may have about the health of your children, and I'll try and answer them in the next less than 1 hour that I have. Okay, the next question is Deborah Oladile. What could be the solution to a child who opens their mouth even after cautioning him? Always start with the age of the child. You will always like to know the age of the child, um, and to avoid bad set of things. Okay, so some children could be mouth breathing, so which is why we need to know the age of this child. Some babies also open their mouth. There's really nothing wrong with them. But if a child is opening their mouth because they are mouth breathing, that means they are breathing through their mouth. Most times, children breathe, you can breathe through your nose and through your mouth. And most children will breathe through their nose. Most of us breathe through our nose. But sometimes, for some children, for some reasons, they open their mouth to mouth breathe. So, especially for children who have like adenoids enlargement, so there's some obstruction along the airway, so the body is trying to get more air into the lungs. So that is why they open their mouth to mouth breathe. So the most important thing is to address the underlying reason why the child is mouth breathing. It's not a matter of cautioning the child or spanking them or any of those things. No, sometimes it is just a medical issue. So if the child has adenoids enlargement or things like that, then you need to see the ENT doctors, and then they can deal with the manage the adenoids itself, and then hopefully the mouth breathing will stop. Sometimes some children have some neurological condition. So for example, children with cerebral palsy, children with what we call spinal muscular atrophy, there is some weakness around the face and the mouth, and in the muscles, so they don't have that strength of there's not enough strength in the muscle to keep the mouth always closed. So such children sometimes can also open their mouths. They tend also to drool saliva as well, because they cannot always swallow enough of their saliva. So those children may have those. Sometimes we try to deal with it, for especially if they are drooling a lot, by giving them some medication to control the spitting and all that. But most times it's just it's part of the underlying medical condition. And some children can also do it as an habit, but if it's an habit, you can easily remind the child, but they will outgrow that. But most of the time it is either there is a obstruction in the airway and they are mouth breathing, or it is what we call weakness of the facial muscles, and so like in cerebral palsy and other neuromuscular conditions that will make them to do that. That on its own does not cause bad teeth. It does not cause bad set of teeth. So if you are worried about the teeth of the children, you have to see the dentist for any concerns around teeth. But the children opening their mouth is not what is causing bad dentition, So any concern around that teeth area, just see the dentist. Okay, I got question on Instagram. Let me quickly go there so that it doesn't disappear. Chumsy296. Good evening. My 2-year-old has rashes on his leg that start like small boy. He's scratching them. They open up. You've seen a pediatrician, and they said they were insect bites. So I'm assuming they are what we call papular urticaria. Papular urticaria, they are kind of an allergic reaction to insect bites. Some people just have that sensitive skin, so when they get bitten by any insect, mosquito, they kind of overreact to it, and they have this swelling. And when they scratch it, it will heal. It become like a little wound, then it will heal and leave all those dark spots. So it's a form of an allergic condition. And I'm happy that you have seen the pediatrician and she has referred you to the dermatologist. So you seem to be seem to have done the right thing. So I'm not quite sure what the question is. So you said they prescribe a cream, it wasn't available at the hospital. So you can ask the pharmacist will be able to give you idea of where to get the cream. I'm just concerned, wondering if you should be on the antibiotics. No, the child does not need to be on antibiotics. So one of the things I always try to emphasize for parents, especially mothers, is like, in medicine, you don't just give people drugs. We don't just give drugs because we like giving drugs. You give drugs, you treat what is causing the issue. So a lot of time people will just ask questions, say, what drug should I give? No, that's not the right question to ask. The right question to ask first is, what is causing this issue? So in the case that you have just described, which you have seen the pediatrician, the dermatologist, it's an allergic condition. The child is having like a form of sensitivity or reaction. Some other children will have insect bites and they won't have all those swelling and wounds and marks on their skin. So, but children who have papular urticaria, which is an allergic condition, have that tendency, to have that reaction. So the solution is dealing with the allergy, not to give antibiotics. It's not an infection. Okay, so unless there's now secondary bacterial infection, like if the wounds exposed, and they are now exposed to germs, or the child's hands are not worried, they can introduce germs, then it will start having pus. That is when maybe antibiotics will be necessary. But the urticaria on its own is not a bacterial infection, so the child does not need antibiotics. The child needs anti-allergy treatments, and I'm sure that's the kind of drug cream your specialist must have prescribed for you. And more importantly, avoid the triggers. So if you can avoid the child having insect bites, so we talk about wearing them long sleeves, clothes, trousers, things that will cover their legs, really. Avoid areas where there are insect bites. Make sure the house is fumigated, the gardens, everything. Avoid them walking through grasses and things where they can get exposed, really. And of course, keeping the nails short, because they tend to itch a lot. So keeping the nails short and washing their hands often, those are things that can help. So there's no reason why the child should get antibiotics. So let's avoid just giving antibiotics for rashes. Okay, it's one of the challenges we have in Nigeria. A lot of us misuse antibiotics, and it is actually quite dangerous to do that. I think we've talked about that before, but please do not give antibiotics when doctors have not prescribed one. Okay, so your child does not need antibiotics. I trust if the dermatologist felt the child needs it, they would have prescribed it. So the fact they didn't prescribe it is reassuring. If you misplace your prescription, the best thing to do is to go back to the person who wrote the prescription for you and get another copy. So that shouldn't be hard. Just call the hospital where they prescribed it and tell them you misplaced your prescription. I'm sure they will have it in the child's record, and then they can send you the name of the medication, or they can send you an alternative prescription. So that shouldn't be too hard. All right. Okay, the next question, still on Instagram, Ife Ade Ayade. Okay. How do we protect our children from hepatitis B? Okay. How long does the pen at 6, 10, and 14 weeks protect them? Okay, thank you. That's a lovely question. I think about a week or 2 weeks ago, we talked a lot extensively about immunization. All right, so hepatitis B is a virus that can be passed through For babies, actually, most of the time they get it from their mothers. It's either through when the mother is pregnant or when she's breastfeeding, or for adults, you get it through sexual intercourse with people who already have hepatitis B, or you can also get it through blood transfusion if the blood is infected. Normally, we screen blood for hepatitis B. We screen people that donate blood to make sure they don't have hepatitis B and HIV. We also screen the blood as well for hepatitis B. So very, very unlikely if you get your blood the right way to get blood transfusions to giving people hepatitis B in this age. But any exposure to body fluids, like if somebody who have hepatitis B has a cut and like they're bleeding, and somebody else also is bleeding or has a cut and the blood kind of mixed, or body fluids and all that, that is how most people get hepatitis B. But for children, uh, especially, the commonest way they get hepatitis B is mother to child transmission. It's just the same thing like HIV. It's usually from the mothers who already have hepatitis B, giving it to the children during the pregnancy or through breastfeeding. So that is how babies will get hepatitis B. But the good news about hepatitis B is that we have a vaccine. So we have a vaccine against hepatitis B. So hepatitis B vaccine is available. We'll give the first dose, what we call hepatitis B 0, at birth. We give it within within the baby is born, they should be given HPV 0. And then we give at 6 weeks, at 10 weeks, and at 14 weeks. So those are the doses that we give. It is part of the Penta vaccine that we give at 6, 10, and 14 weeks. Now, after we believe that the protection will last for at least 18 months, but it can wear off. So it is recommended that we give booster doses at 18 months and at 5 years. But in Nigeria, that is not yet part of our own schedule. In other places like UK, for example, they will give you the boosters, but we don't yet give hepatitis B boosters in Nigeria. It's available. You can buy it if you want, but it's not yet part of our routine immunization schedule. So, but you can buy it if you like. And for those of us who work in healthcare, who work in organizations that are more likely to be exposed to hepatitis B, you can imagine those of us who are doctors, nurses, lab scientists. We're exposed to blood all the time. We're taking sample where we could prick ourselves. So we also get extra doses of. I think we're supposed to get a booster maybe every 5 years or something. So we also supposed to be fully immunized. But the 3 doses your child, or the 4 doses the children get in their first 3 months of life, should protect them quite a long way. It's just that it may wane, so that is why we recommend booster doses. But it is not yet part of our routine immunization schedule. But it's available if you want to pay for it. All right, let me come back to Facebook. I got a lot of questions there. Ifoma, good evening, Ifoma. Thank you for joining us. You're always consistent. Okay, your 11-month-old has had the same weight since 9-month-old, which is 10.4. I'm not too worried about the weight. The weight is still okay. One thing you need to remember is that children gain weight rapidly in the first year, but then after that it begins to slow down, because so from birth to 1 year, the child is going to gain about 7 kilos. So the child is gaining 7 kilos over 12 months. But from 12 months to 14 months, 24 months, in other words, over another 12 months, that child is only going to gain 2. So there's a rapid rate of growth in the first year, but it begins to slow down. So after 1 year, it will slow down, because the amount you are going to gain, now in 1 year is just 2 kilos. Whereas in the first year, you gain about 7 kilos. So the rate of growth, or rate of weight gain tend to slow down. So we are not surprised. So it is not surprising that sometimes children may stay at some weight for a while because the rate tends to slow down. And for us, as long as the weight is still normal, we are not going to worry. So we're not worried about a 11-month-old baby weighing 10.4 kilos. There's nothing to worry about. So just because the children are also more active. So in other words, it's not as if the children are just eating. Remember that the first half of their life, they are just sleeping and eating and lying down. But now, as they are getting to 9 months, they are crawling. So they are using those energy more. So it is not that you are not giving enough food, but the food is not all going to weight gain. They are now using it for activity. They are crawling, they're standing, they are moving around, so they are burning off more energy as well. So just make sure you are giving enough food. But your child's weight is already even more than what we expect at 11 months, because 10 kilos is the weight of a 1-year-old child. So I am definitely not going to worry about it. And as long as for us the child is maintaining a healthy weight, that is more important. So the child is already more than what the child should be at 1 year. So we are not really looking for the child adding more weight. And I think it's actually a good thing that the child is burning off the excess. Otherwise, the child will also become overweight and go to the other extreme, which we don't want as well. So I'm not really worried about the child's weight. And you should not force feed the child. The child obviously is getting enough food. I won't really say your child is not gaining weight. I think you will say your child is maintaining the weight that you should have, which is not thing to worry about at all. I hope that is reassuring for you, Ifoma. Okay, Shamsi is asking that there's a hepatitis B they give her 2 years. So if you are not following the schedule of the country, if you are not following the national program on immunization, different hospitals do different things. So there is there's only one hepatitis B. All the vaccines are the same, but it can some people have hepatitis B that is combined with hepatitis A. Some people have hepatitis B standalone, or hepatitis B can be part of penta. So, but the hepatitis B component of it is still the same hepatitis B. Okay, so but if you are not following the national program schedule and your hospital is giving all the vaccines, then you need to ask them which one they are giving so that you understand it at all. So if you want to give booster doses 18 months, 2 years, it is okay. There's no problem with that. So just but make sure you understand what is being done, and don't call it hepatitis B if you are not sure of the name, because there are different kind of vaccines people give at different times. So make sure you know which one it is that they are giving the child, and be sure of the name. Usually they write it in the card as well. All right, Shukura say he start putting his hand in his mouth. Anything he sees in his mouth, I don't know what to do. There's nothing wrong with the child putting his hand in his mouth. There's nothing wrong with the child putting things in their mouth at 4 months. That is normal. So children are in that age, we call it oral motor stage, where everything they have in their hands goes to their mouth, and that is perfectly normal. So you don't need to do anything about it. So there are things that are normal. I don't know, you don't have to fix everything. Some things are not broken, so there's nothing to fix. So what you just said now is that he's putting his hand in his mouth, and anything he sees in his mouth, I don't know what to do. You don't need to do anything about it. That is normal. That is what we expect for a 4-month-old. So I always prefer you ask first, whether something is normal or not, so that you don't start getting unnecessarily anxious over something you should not be anxious about, because that is perfectly normal. I would be more worried if your child is actually not doing that, because that is what is expected for a 4-month-old. What you really need to do is to pay attention to hygiene. Make sure you wash their hands off, and make sure the environment is clean, so that even if the child is putting toys, if you're giving them toys like teethers or things they can put in them, like soft toys and stuff like that, make sure you wash, sterilize them. That is all you need to do. You don't need to do anything about the child putting his hand in his mouth. That is perfectly normal and expected at that age. Okay, so Shukura, you don't need to worry about it. All right, let's move on. Ifeoma is still asking about your 11-month-old. Okay, I just answered the question now. I think, yeah, okay. I moved to Facebook. That is why. Okay, we've answered your question already. Okay, I think you asked it twice. Okay. Okay, Chokora, you are saying your baby is on exclusive breastfeeding. So just continue exclusive breastfeeding for another 2 months. Your baby is 4 months old. So you're going to continue exclusive breastfeeding till your baby is 6 months old. And when your baby is 6 months old, then you can start complementary feeds. And if there's heat, make sure you keep your windows open, make sure the room is well ventilated. It's okay to use the air conditioner in your room with children and babies. It's okay to use their fan. Please let the room be cool and well ventilated, but keep breastfeeding exclusively as well. All right, let's go on to Facebook again. Omeke Abigail, good evening. What can make a baby finger look like something soaked inside water for long? Okay, I'm not quite sure I understand what you mean, but do you mean that is the skin looks uh I'm trying to look for the word, like wrinkled or like macerated or something, um usually happen when the child is crying or sweating a year plus. I'm not quite sure what you're trying to say, but it would be nice to see a picture of the fingers and see, but definitely I'm not sure it's something I'm going to worry about anyway. So if the child is sweating and crying, there's water obviously on the skin, but that would not be something we're going to worry about really. But if you want to show us, you can post a picture of it on our Facebook group, and then we can have a look and give you further advice. So somebody is joining us from YouTube finally. Emily Anibe 932. Thank you so much. I'm always excited when I see people joining from YouTube, because I know YouTube is not always we don't have as much people on YouTube like we have on Facebook and Instagram. Oh, thank you so much. Okay, fine. He's saying, is SMA gold not good again for babies? Okay, that's a very number. Like, I don't like to talk about brands, and I don't want anybody to come and sue me for talking about their brands, and they're also not paying me. Okay, so when you say baby, I also want you to clarify the age of the child. But if I assume what I assume you're talking about babies, the best food for your baby is your breast milk. No matter any brand, no matter the name of the brand. I think mothers will like to we like to to fall for the adverts made by this company for their all the advertising gimmicks, and that is why you will never see those products advertised on your television, because there's what we call a breastfeeding code. There is a code for marketing all this what we call breast milk alternative or breast milk substitutes. You will never see them advertise it, but they have their way of getting mothers to say, oh, I like this one, and maybe they put in the gold, make it sound like it's something lovely. It is not. It is inferior to your breast milk. I can tell you that for free. Okay. And if you look on the can of any of these products, you will see it written there, whether it's from US or from UK, from any part of the world. Breast milk is best. It is always written on every bottle of formula. There's a reason why we do that. We want you to always know that there's something better than even that can of formula that you have in your hand. It is written there. It is compulsory. They must write it on it that breast milk is the best for your baby. Okay, so we don't talk about formula being good or not. It is a substitute. Okay, it's an there's original, and the original is your breast milk, and the original is the best. Okay, but of course we know there are certain scenarios where we have to look for substitutes. Okay, for example, a mother could be late. Some mother passed during childbirth. Does that mean we should not feed the babies? Previously, we used to do a lot of breast milk banking, and I think we're actually returning back to breast milk banks. In other words, those women who have excess breast milk, or if you want to donate, you express and you take it to the breast milk bank, and we pasteurize it and we store it and we use it for babies like that, babies who lost their mom at birth and things like that. But with the HIV and hepatitis B and all that, we kind of were a little bit skeptical. So people begin to be, careful about using other people's breast milk, because you never know those who have HIV. And even if you test them, they may be in the window period of 15 days and things like that. So that is why we begin to move away from breast milk bank. But now we're going back to it as well, because we can now test, we can pasteurize, and leave it for some time before we give it to babies. But breast milk is the best for the babies. But if there are any underlying reasons, maybe mom is late, some other mothers, for example, who are on chemotherapy medications. If a mother is being treated for cancer, she can't breastfeed her baby. So those kind of mothers, those kind of babies, we will give them. Those are the people that we need those breast milk substitute for. And trust me, they are less than 1%. Majority of us who are giving our babies all this formula, we have our breasts and we have our breast milk, and that is the best for your babies. And most of our reasons for not exclusive breastfeeding our babies, they are still excuses, because we can actually exclusive breastfeed our babies if we want it. I always tell mothers to breastfeed from your brain, not in your breast. A lot of our grandparents, apologies to them, and mean no harm or disrespect, but sometimes they just always try to make you feel like you cannot exclusively breastfeed your baby. Oh, the baby is hungry, baby is crying, blah blah blah. Most times the breastfeeding is about, it's not breastfeeding week, but we always get to breastfeeding week in August. But breastfeeding is about you making up your mind that you want to breastfeed, and the more your baby suck, the more your milk will flow. Okay, but most of the time, so my milk is not flowing, let me go to this formula, and then your milk will also reduce further, because it's a vicious cycle. All right, so if your milk is not flowing, the solution is not to give your baby a substitute. The solution is actually to breastfeed more. The solution is to make sure we are making sure our baby is well attached to the breast, okay, and sucking not on the nipples but on the areola. Okay, so you will never see us as a pediatrician. We're not supposed to talk to you about any formula. That's also part of the breastfeeding code. So breastfeeding code means all these formulas should never be advertised on television. Doctors, healthcare workers should not be talking to you about using them. Okay, so that is why those of you who are always upset that ATP doesn't talk about formula and other, that is why it's also part of the breastfeeding code. And then they should never be advertised. And on every formula, every can, it is written there for you to know that breast milk is the best for your baby for the first 6 months of life. That is also important. So there is no formula that is close to breast milk, none of them, because breast milk is more than food. There are things in breast milk like antibodies, protective agents that protect your babies against infections, against diarrhea, against pneumonia. No formula is going to add that to it. Do you know your breast milk is unique to you and to your baby? So your breast milk is not the same as that of your neighbor, okay? It is customized for your baby alone, because your experience is going to be different from that of your neighbor. And the breast milk you produce if you have a preterm baby is different from what you produce if you have a term baby, okay? And the breast milk you produce even at different time of the day, at different time of the age of your baby, it's also different. So whereas formula is the same, whether you have a newborn, whether you have a preterm, it's the same thing they are going to pack in, and they are made from cow. And some of these proteins, some of our babies are even allergic to them. They are allergic to them because they are not human proteins. So some babies have cow milk protein allergy and all that. So there are many reasons why all these formulas are not the best, but we only reserve them for those scenarios where we do not have breast milk. A mother who is late, a mother who is on chemotherapy drugs. Some babies have some very serious metabolic condition, very rare, but in those babies, sometimes we cannot give them breast milk. Those are the reasons, the only reason why mothers should not breastfeed. Those, just about 2 or 3 of them. Majority of all these excuses, oh, my breast is not flowing, we can help you with that. So we have breast milk lactation consultants, we have our nurses, we have our midwives, we have what we call breastfeeding support. We have many things we can use to support you to breastfeed your babies, and that is what we do, because breastfeeding your baby will keep your baby healthy. It is not just feeding your baby, it's not just about gaining weight, it's about keeping a healthy baby. Even mothers that have HIV, before we used to say, even mothers that have HIV, we found out that it's better for them to actually breastfeed their babies, because more babies actually die from the formula feeding than when they are breastfeeding them. and now we just give them drugs to make sure they don't have HIV. So we never encourage formula. So we never promote any formula brand. We prescribe it like medication for situation where we don't have breast milk, and a pediatrician has to prescribe it actually. But I know it's not easy. Many of us can easily go and buy, but ideally in an ideal world we should be prescribing it for situation where it's needed. Otherwise every mother should be giving the baby's breast milk, and so that is what you will always see us promote on Facebook, anywhere. And it's also part of the breastfeeding code. You can Google breastfeeding code, you will understand more of what I'm saying. Okay, Deborah Oladele, you were asking about the 4-year-old who is mouth breathing. I mean, who is opening his mouth. I think you should make sure that child is checked for adenoids, see an ENT doctors, and they will take it from there. Okay, Olarunshola, Kenny, Caroline, your question is, this measles vaccine, you've not collected it. Okay, no problem. Why have you not collected it? I've talked about it for more than, I think I've talked about it all this since beginning of the year. Please collect it. I've tried to explain the routine immunization versus the what we call supplementary immunization. So routine immunization are the one you've gone to take by yourself at the health center, but once in a while we are trying to deal with a particular outbreak, like there's going to be a measles outbreak, or we're trying to get rid of a particular condition like polio, for example. So when we are doing that, we need to give all the children extra doses of the vaccines, and at the same time there's a concept of what we call herd immunity and all that, but don't worry about the medical jargons. But so the extra doses of vaccine we give, it is for specific purpose. Okay, we're trying to deal with a particular condition. So in this case, we're trying to do with measles and rubella. Okay, measles is one of those childhood killer diseases. So that is why we're immunizing all the children. We want to avoid a measles outbreak. I'm sure if you read the news, you can see there's measles outbreak is it's going up in US, in UK. These are places that don't have these conditions before, but because of the advent of social media and anti-vaxxers, everybody is getting scared of vaccine, and actually they stop. And now places where they don't even talk about measles and things like that, now they are beginning to have outbreaks in US and UK and all those other places where those are not even issues for them before. So it is partly why we're also doing this, because we want to protect our children, especially children under the age of 5. And then most of our children before have not gotten rubella vaccine. So that is why it's extended to 14 years, so that the girls can also be protected. Though rubella is not as bad as measles, but it's also something that our children should be protected from. Rubella is the German measles, then you have the normal measles. So please take it for your children if you can take it, okay? And so if your child is 2 years old, your child should take the booster, the measles rubella vaccine. And I'm sure your child has not taken rubella unless you've taken MMR, so it's still good for you to take it. If you are going by the Nigerian schedule of immunization, we don't really have any vaccine for 2 years. Our vaccine, we have 9 months and 15 months, and then the next vaccine will be at 9 years or so for the human papilloma virus vaccine. So we don't have any vaccine for 2 years. But if you want to take vaccines that you can pay out of your own pocket, not for free, you can take things like chickenpox vaccine. It's available and it's given at 2 years, so you can pay for those ones. But otherwise, we don't really have any other vaccine at 2 years in the Nigerian program on immunization. All right, let's move on to the next question. Udrak, say good evening. Thank you for all you do. Okay, you also miss the MR vaccine. How many people have missed the MR vaccine? I don't know whether it's still available, but you can always check at your health centers. I'm sure it should still be available. Just go get it. Okay, your baby you can get it, even though your child. So the child that has taken the routine vaccine doesn't stop the child from taking the supplementary vaccine. They are not the same. So a lot of mother asked that question, which is why I took time to explain the routine versus the supplementary vaccine. So your children are taking the routine vaccine, they should still take the supplementary extra dose, the one we are giving, because the goal is different. Okay, the goal is different. So when you are taking your routine vaccine, the protection is just for you and your child, just for that child alone. But when we are giving the mass immunization campaign, the vaccine is, the goal is a little bit bigger, and it's about a wider national or community uh, uh, approach to dealing with a particular infection, like a measles outbreak coming and all that. And of course, even children that have gotten the routine immunization, giving them those booster, those supplementary vaccines will boost their immunity, so their body will be much more primed to fight against the outbreak that's about to happen. So please, you can still go and get it. Um, it won't affect him. The vaccine doesn't affect it. I don't know what you mean by affect him. Is it going to cause any harm, or is it going to cause any side effect? No, you can give your child the vaccine, and that will be helpful. Christy111, good evening. Welcome on Instagram. Feel free to ask your question. Instagram people, I'll try and answer that. So give it to him, and you still go for your measles 2 at 15 months. Is absolutely okay. Don't worry, too many vaccines do not cause any harm to children. It is actually not taking the vaccines that will cause harm to children. All right, Mansura Elebute, your 7 weeks old baby at Qatar, what should I do? You don't really need to do anything. It's just keep breastfeeding the baby, and stop being emotionally worried. I know, but you don't need to worry so much about your babies. I'm concerned because you say you're emotionally worried, because when you are emotionally worried, you are actually going to reduce your breast milk production, because when you are stressed, you produce stress hormones, and stress hormones are anti-breast milk production hormones. So your body will begin to produce cortisol and hormones instead of producing hormones that will favor you lactating and breastfeeding your baby. So just relax. There's nothing wrong with the baby. Qatar is just a virus, okay, that your baby has. Most of them don't require any treatments. Most of them are going to go by themselves. What you really should do is to prevent it by making sure you keep your baby away from people with cough and colds. Most of the time, usually it could be siblings or adults in the house who have cough and cold. They are the one bringing it to the baby. So you want to keep the baby away from people like that, and keep breastfeeding. When you breastfeed exclusively, your baby also have immunity, which is what I was trying to explain. When you are breastfeeding, you are not only just passing food, the lactose, the milk, and the sugar, you are also passing antibodies. I will call it immunoglobulin G, immunoglobulin A. These are antibodies that protect against all these viral infection. You must have had all this viral infection before. So when you now breastfeed, you will pass it to your baby, and that will keep your baby from having respiratory infections. So if your baby also have fever or cough, or the baby is breathing fast, then you may need to take the baby to the hospital, because that may just be more than respiratory infection, because you say Qatar alone, so that's why I'm not worried. But if there's cough or fever, or the child is having difficulty with breathing, I will worry about, pneumonia and other serious chest infection. And for that, you need to take the child to the hospital. But if it's just a catarrh, the nose is running, just wipe it, keep breastfeeding your baby, keep your baby warm, your baby will be fine. If the nose is blocked with the mucus, you can apply saline drops. The saline drops is not a drug to treat the catarrh or make it go away. It's just to soften the mucus so that it can flow out, because I've seen a lot of mothers asking me, can I give saline drops, because they're asking it in a way that suggests they want to use it to treat the cough and catarrh, and the babies that's actually having running nose. So you don't need saline drop if the nose is running, because there's nothing blocking the nose, so there's nothing to soften. But if the nose is blocked and you can see the mucus is so thick and it's not flowing out, babies cannot sneeze and clear their nostrils like that. So you can use the saline drop. It will soften the mucus and it will flow out, and then the child can breathe easy. Otherwise, you don't need saline drops if your child doesn't have a blocked nostril. And there's no specific drug for treating catarrh. It's a virus. It will go on its own. We don't usually treat viruses with antibiotics. So please don't give your children unnecessary medication. I hope that's helpful, and just relax. You don't need to be emotionally worried. Okay, let's just answer the question on Instagram. Christy111. How many ones are after your name? I'm not sure I can count them. Anyway, your 16-month-old baby is attached to breastfeeding that you can't go to bed without breastfeeding till he sleeps. Okay. There's still nothing wrong with your baby 16 months of breastfeeding. I mean, we recommend that you breastfeed for up to 2 years. The longer you breastfeed, it's actually beneficial for you, not just the baby, because the longer you breastfeed, you're actually protected against breast cancer. I hope you know that. So your baby is helping you, protecting you against breast cancer in future. So, but I understand that it can be quite stressful for you. You can start letting your baby sleep on his own bed instead of sleeping with you. That may be a way for you to break the cycle. But most babies at this age will still want to breastfeed, so there's nothing wrong with it. But those are things. But we don't want baby using the breast as a pacifier, like they just need it in their mouth, even though they don't really need to suck. So you can put baby on his own bed, and but breastfeeding, you don't need to stop. You can't stop breastfeeding through the night, because that's the most time babies suck at this 16 months. So because most of the time I'm assuming you will go to work and all that, so during the day they are eating normal food, they are eating everything. So that breastfeeding through the night is actually the last part to go. So I don't think that is actually that's the way you should say that you want to stop breastfeeding through the night. So most of the time when we're trying to win babies off, the breastfeeding during the night is actually the last part to go, unless you want to win the baby completely, um, which you can, but we usually recommend you do it up to 2 years if you can, and then you can win the baby. When you're ready to stop, you just have to stop. There's nothing to stopping it. You're going to stop, the child is going to cry for a couple of days, and then if you don't give the breast milk will dry off, and that is it. So but if your baby can see, if your baby is still breastfeeding at 1.5, it's good to continue if you can. But if you don't want to, then you just have to stop. But we recommend that you continue. 2 years and beyond is our recommendation if you can manage it. Okay. Oh, Pomije, good evening. Is it okay for a baby of 8 months to poop 2 to 3 times a day? There's nothing wrong with that. Baby can poop even up to 12 times or 20 times. It doesn't really matter. What really matters is whether the stools are normal texture or watery or hard. So that is what we worry about. So if your baby is passing normal stool, and I think I should have my stool. Let me see whether I can put the stool charts. Okay, I have the stool chart here. So this is the stool charts. I don't know whether you guys can see it. Can you see it? Yeah, so this is stool chart. So the stool chart is the type 4 is what we want. Normal stool, like a sausage, or like a snake, very smooth, very soft. That is a normal stool. If your baby is passing normal stool, whether it's 2 times, 10 times, we are not worried about it. We're worried if your baby is passing watery stool, then that is diarrhea, like type 6, 7. I'm not sure whether you can say it, because okay, let me remove your comment so that you can say it. If your baby is passing watery stool, that is when you now need to so yeah, so if it's entire liquid and it's more than 3 times a day, then that becomes diarrhea. That is when we worry about it. Or of course, usually for hard stool, they don't even pass. They may not pass for several days, like type 1 to 3. Those are the hard stools, and those are the ones that we worry about. So if your child is passing normal stools, whether it's 10 times, 4 times, there's nothing wrong with that. We're not going to worry about it. So nothing to worry about. Focus more on the texture rather than the frequency of the stool. And then the second part, it doesn't like sucking during the day. Is the baby sucking? So most of the time, the issue with sucking during the day is that sometimes we also overdo the complementary feeding. So if you have given so much of the complementary feeding and the child doesn't feel like sucking, then the child is not going to suck. So make sure you balance it. So a 8 months old baby should be eating like 3 times a day, and in between the breast milk is what the child should take. But whether the child suck during the day or during the night, it doesn't matter, as long as the child is still sucking, because the child still need breast milk. But it depends on how much of the complementary food. Just make sure you are not overdoing the complementary food. The weight is not bad. The weight is okay. I'm not worried about it. Uh, and next question. Olorunshola Kenny, 11.7 for a 2-year-old. It's not bad. Usually, an average 2-year-old should weigh 12 kilos. So 11.7 is close to 12 now. So it's still normal, and I'm not worried about it. Okay, and then Shukura saying, can my baby use Tita? Because yes, your baby can use Tita. Tita is just a soft toy that the child can bite on. There's nothing magical about it. It's any soft toy that the child can bite on. Of course, big enough, not something the child will swallow. Okay, so but the most important thing is that you wash them and sterilize them. But it is okay for your child to use them completely soft, but avoid the one that has liquid inside, so that the liquid doesn't break into the child's mouth. Just soft toy is fine. If I'm let's see, my child did not get a third dose of the roadside. I think you've asked me this question last time. I can't remember what it is we said. When your child doesn't take a particular vaccine, it just means that the child is not protected fully. That's what it means. So at least your child has gotten 2 doses, so there is some level of protection, but the third dose will give better protection. So that is the only thing. What that means is that if your child is not fully protected, then your child can have the condition that we are protecting against. So your child can have rotavirus infection. That's the only thing that can happen. Otherwise, there's really no particular effects really. So for vaccine, people tend to ask a lot, if my child didn't take this vaccine, what is the side effect? What is this? The side effect is the fact that the child is not protected against that particular vaccine, the disease that we're using that vaccine to protect your child against. So that means your child can have that condition. So vaccine is like learning. So when we give vaccine, it's learning through other people's experience, more or less. So your child already taking the vaccine, and his body has know how to protect it. So if the child now gets exposed to that particular disease, the child will not be sick because the child has immunity already. Whereas if the child doesn't have a vaccine, then the child will learn through his own experience. So your child can be exposed to the germ, and the child will have the germ, will get the infection, and we hope the child survive it, and then that way the child has learned through the experience. So what we do with vaccines is that we protect the children so that they don't have to learn through the experience, because learning through the experience on their own can lead to serious consequences. We may lose the child, and a very ill child. But if we've given them the vaccine, then they are already protected, so that when the disease actually comes, then they don't need to have it. So that is the idea behind immunization. So as much as possible, let's make sure the child gets it. But your child is after the age of 1 year, rota is actually not a major priority for us, because the peak period of rota infection is 6 to 11 months. Most children who are going to have rota or very bad rota infection, they can still have it up to the age of 5 years and beyond. But the peak period when they tend to have all this diarrhea and very serious illness from rotavirus is 6 to 11 months. So if your child is already 11 months, I'm not going to worry so much about it. And luckily, diarrhea is also treatable. We give children ORS and all that. Even though it's treatable, some children still die from it. So which is why we still like to protect the children, but otherwise we don't panic about that. So Hope is asking, how true is it that you can only use Pando? Pando, what do you mean for Pando? Do you mean what's it called? Panda. I think it's Panda. You want to say the paracetamol drops, okay, for 1 month, and after 1 month you should not use it again. Yeah. So let's start by saying, irrespective of the brand name, what you've mentioned is just a brand name. Paracetamol is paracetamol. There are different kind of paracetamol. So and then the way we present paracetamol, there's I think maybe we need to bring the pharmacist to come and talk to us. So there's what we call formulation of medication. Okay, so we have drops, we have syrup, we have tablets. Even the tablet, you can have the one you will chew, you can have the one you will swallow, We even have the one you can put in through the anus. We call it suppository. They are all containing the same thing. It's just that the way you give it to the child is different. So for newborn babies, they are very small. They can't swallow so much liquid. So we give the paracetamol as drops. So the quantity of paracetamol in 1 meal for a newborn baby is actually 100 milligram in 1 meal. So that small 1 meal is 100 milligram of paracetamol, so that you only need to give a few drops to achieve your goal. But once the children get older, obviously they can take more liquid. So usually most drops are actually for children in the newborn period most of the time. So after, apart from the multivitamins, sometimes some of them, the drops continue even longer, but the paracetamol drops, we prefer you use it only in the newborn period. And newborn period, neonatal period, is 0 to 28 days, 1 month. After 1 month, we prefer you give them the syrup. Okay, you can give the children the syrup from 1 month to maybe 5 years. But after 5 years, most children can start to take tablets. They can chew it or they can swallow it. There are the chewable ones are usually sweeter. So, at least something they can chew, not something that will be very bitter. But the white tablets usually is bitter. So then you can give them, once they are able to swallow tablets, you can give them the tablet. So you see the same paracetamol inside. So there is no law, but the quantity you will give is what matters. So if you are using the drops, it may be the amount you will give. Some of you just give 0.3 mils because that is what they recommend. That is not necessarily true, because for children, we calculate the dose of the paracetamol based on their weight. Okay, so it is based on the weight of the child that will determine how much of the paracetamol you give. So it doesn't mean there's any, if you give, it doesn't mean that if you give the drops in a 2-month-old, it won't work. But it is easier, and for you as a mother, or generally, to give the syrup to the older children, compared to giving the drops. The drops is easier for the newborn babies. So, and then to work out the quantity to give is easier with syrup than, because you can pour it. Whereas for the drops, you are trying to put a little bit in the mouth, and you have to make sure you don't go beyond the marking that the child should have for them. But it doesn't really mean there's going to be any issue if you give it, but it's just that the way the manufacturer packages, they prefer you to give the newborn babies the drops, and then the older babies the syrup, and then the older children the tablets. But we can switch it around depending on, if, for example, if you don't have the syrup and you have the drops, you can still give it, but you need to work out the quantity. That may be a little bit more tricky if you are not used to that. So, but after 1 month, they can take the syrup. And then the duration, how long it will last. So sometimes the drops are, most of those drugs, once you open them within 2 weeks, you're supposed to discard them anyway. So again, so it's not something you can keep and keep. So by the time if you buy a drop when your baby was at birth or 1 week old or something, remember that by the time your baby is 1 month, that syrup, that drop should have expired. You shouldn't be using it again. You need to go buy the next one. So then it's easier for you to buy the syrup because the quantity is bigger, and because your baby may need bigger quantity for that, maybe for 2-3 days that you're going to give it. So there are a lot of practical issues really here. It's a practical issue. It's not like a law that is a poison if you give it. You understand? I don't know whether that makes sense to you. All right, let's just move on. I think my time is up. I can't believe it. All right, I was just going to say my time is running, but let me just finish answering the questions I have, then we will round up. But if you still have questions after the live session, you can always go to our Facebook group, post your questions there. My my wonderful moderators and our doctors, they will always answer you. Just be patient with us. Blessing is saying 9 months completed, 9 months today, but it's not crawling and he has refused to stand. Should I be worried? No. You don't need to be worried at all. Some babies don't even crawl at all. Some babies don't crawl. We are never worried about crawling. Crawling is one milestone that doesn't bother the pediatrician. Your baby may crawl, your baby may not crawl. It doesn't bother us, because some babies will never crawl. They will just go from sitting to standing and walking, and then walking is usually by 1 year. Okay, and some babies may not walk until 18 months before we start getting worried. So everybody is different. Okay, there's an average. So when we say crawling 9 months, that is average for 50% of babies. Some babies will never crawl. Some babies will do what we call bottom shuffling. They move with their bum, they don't crawl on their knees. It is still a normal variation. And some babies will just get up and walk without crawling. It is still normal. So there's absolutely nothing to worry about. Okay, I caught your 9 months of babies here. Okay, what can I rub there? What can you rub? You don't need to rub anything now. Why do you need to rub anything? You don't need to rub anything. Okay, to prevent cold from entering. No, see, this belief, cold is not entering to the anterior fontanelle. So if it is cold where you are, just wear a cap. You know what do you call it? The hats. Just wear the hats. If it is cold though, if not that you have to wear the hats compulsorily. So if your child is fine, the weather is warm and nice, you don't need to wear any hats. Nothing is entering to the anterior fontanelle. It's a very tough membrane that is sealed. So there's nothing entering. Hair is not entering. The hair is actually entering to your baby's ears. Okay, through their nose. That is the air they are breathing in that is going to cool them down if it is cold. It is not the anterior fontanelle. So you don't need to rub anything on the anterior fontanelle. All right. So wearing hats for the baby is to keep them warm if the weather is cold. You can wear hats, you can wear mittens, you can wear socks. It's just the same way you wear you wear your sweater if you're feeling cold. It's just to keep you warm. It's not because of anything particular. It's just to put extra layers. And because children's head is, it's easier for them to lose heat. They are losing heat. It's actually losing of the heat, not that the cold is entering. No, nothing is entering. Okay, so what you need to do is just wear hats for the baby, and the baby will be fine. And you don't need to rub anything on the baby's scalp. And even for those babies, for other people that may be listening, the anterior fontanelle, please just leave it alone. Don't apply oil. Don't apply anything. What's it called? Shawl, all those our midwives, mothers, fables. There's no scientific evidence or basis for all that. Just leave that place alone. It will close by itself around 2 years. It's just a hole that allows the baby's brain to get bigger and allow the skull. Because if the skull is completely closed off without any space, the baby's brain is still growing. So the baby's brain will not be able to grow. Your baby's head will be small. So God kept those holes, the anterior fontanelle, the sutures, so that when the brain is getting bigger, the head can get bigger. That is all why they are there. They are completely normal. They are not doing anything. They are completely innocent bystander, not doing anything. But mothers, we attach a lot of importance to them. So just leave it alone. Monsura, can I use normal saline for softening mucus? Yes, we've answered that already. Thank you for you do. Baby cries so much at night. Chung Ajiji doesn't like sucking, not crawling yet, but turns well. What should I do? Why is baby crying so much? That is my question. Is baby hot? Is baby cold? Is the nappies wet? Is it dirty? As mothers, we are more like detectives for babies who are not talking. So if your baby is crying, we need to know why. And some of us, sometimes we wear all these too much layers of clothes for the babies at night, and they're really hot. But because they can't talk, they're going to cry. So just make sure the windows are open, the room is cool, it's well ventilated, the child is sleeping under mosquito nets, no bugs, or they're not having bites from mosquitoes. Just figure out why is this child crying. A well-fed baby who is cool, who is calm, who sleep, they won't be crying. So there must be a reason why they are crying. So the goal is to find out why they're crying and address it. So think of all this, and honestly, common things occur commonly. That's one of our mantra in medicine. Stop looking for something highfalutin. It may be something as simple as the child is hot, the room is hot. It may be as simple as that, and you just need to remove the extra layers and let there be some breeze around this baby, and that the child will sleep nice. Okay, it could be the heat, it could be the mosquito, it could be anything. Just figure it out. It could be the child is hungry, so make sure they eat their complementary feed in the evening. They eat well, and so just figure it out. And if you can't figure it out, then you come to us. We, the pediatrician, will join our detective work with yours and figure it out. But there must be something making this child uncomfortable. Sometimes even because they are too full, because the food has not digested. So make sure you don't give them the food just before sleep. Some of us, once the baby has finished eating, then we want them to sleep straight away. No, they shouldn't be sleeping straight away after the big complementary feeds in the evening. They should have at least another 1 hour or two to run around and play, so that the food can digest a bit. Then you can now, if you want, some of like the mother that asked the last other question about breastfeeding in the night, then you can breastfeed them to sleep, or you can just let them sleep on their own. So, but avoid, just make sure you are not doing too much of either of them. So that's just the I think the most important thing is to figure out why the child is crying and deal with it, and then the baby will be fine. And if you are not sure, come and see us. And the question about crawling, I think I've just answered it. Some babies never crawl, and we will never be worried about crawling. But if your child is not walking by 18 months, that is when I will worry about it. So just be patient, be patient, be patient. Okay, if I say a 3-year-old with a weight of 23 kilo, is it too much? Yes, it is too much. It's too much. 20 kilo is the weight of a 6-year-old. An average 6-year-old weighs 20 kilos. So even 23 kilo is almost the weight of a 7-year-old. So if a 3-year-old is weighing the weight of a 7-year-old, I'm definitely worried about it. But first, I want you to go and recheck the weight, because sometimes people will say, oh, my baby is weighing 23. Then you see this child, this child cannot be weighing 23. So sometimes it could be scale error. It could be, measurement error. So go and put the child on a scale in the hospital, not your own bedroom scale. Some of our bedroom scales are faulty. Some of them give wrong reading, but hospitals we tend to have very good quality scales. So take the child to the hospital. Let us weigh the child again. And if the child is truly weighing 23 kilos, then you need to see a pediatrician. We need to know why, because I don't think it's food alone. Sometimes some children have some medical conditions, syndromes that could make them gain weight rapidly, and we need to deal with it. There could be like thyroid issues and all that. So there are many reasons why children could gain weight so rapidly. So we really need to know why. So if you've checked the weight again in a hospital with a nurse or a doctor and it is still 23 at 3, please see a pediatrician. If you don't know where to go, see one in a teaching hospital closest to you. That is not good. Too much weight is putting pressure on the heart, and that can cause death. We don't want that to happen. So let's quickly do that. But for check, because sometimes it's just measurement error. Yeah, it's just a false alarm. Last question, Bioluwatife. What a name. I like that name. Good evening, Doc. My baby of 10 months has been stolen, whitish mucus, vomiting non-stop. Oh, yeah, the child is sick. You've gone to the hospital, good. All right, they give you malaria, ORS, it doesn't stop. I hope they kept you in the hospital. Zinc and flagyl syrup were prescribed, but it doesn't stop. So number one, they shouldn't have discharged your baby if your child is vomiting non-stop. That a child with vomiting non-stop is not going to tolerate ORS. It's not going to tolerate oral drugs. That child should have been kept in the hospital, and we are going to put the child on drip. That is it. We are going to have to put the child on intravenous rehydration, and until the vomiting stops. Then when the vomiting stops and the child starts to drink oral, ORS, drink by mouth, and it's not vomiting, then that is when you can go home. And I'm sure your doctors would have investigated the cause of the diarrhea and all that. You didn't tell us how long you were in the hospital. You just say it's non-stop, it has not stopped, but you didn't tell me how many days, because sometimes diarrhea, gastroenteritis can last up to 10-14 days. Yes, I know parents want you to stop in 1 day. Unfortunately, again, just like the cough and catarrh that I was talking about earlier, most diarrhea are actually from viruses like the rotavirus. That is why we give our babies rotavirus. I'm not sure whether a child got rotavirus immunization. This is the reason we give rotavirus. This question is the reason we give rotavirus. Between 6 to 11 months, babies can have rotavirus infection and they can have this severe diarrhea and vomiting. So if I want to put my money, I would say maybe this child has a rotavirus infection. That doesn't really need antibiotics. So, but some children may still have the diarrhea despite if they were not immunized against rota, or there are other viruses. So it's not only rota, but rota is the number one in terms of causing diarrhea and vomiting, and it can really be very serious like this, vomiting and the children, so what we need to do is to rehydrate your child. And so if the child is vomiting and is not able to drink, we have to keep the child in the hospital. There's no other way around it. So we have to keep that child and then wait for the diarrhea to stop. It may take, we don't give any drug to stop diarrhea or vomiting. We wait for them to run their course. I think the issue here in this case is the vomiting, because the vomiting is the one, because if child is having diarrhea, no vomiting, we can just give ORS and just keep giving the child ORS. Whether it take 10 days, 14 days, we'll just keep giving the ORS and oral zinc. But once we get to the point where the child is not able to tolerate ORS and the child is vomiting, then that's when we have to keep the child in the hospital. And so I don't know whether you are back home now or you are still in the hospital. It's not quite clear. But if you are home and the child is still vomiting, the child is still having watery stool, the child is not drinking the ORS, the child has to go back to the hospital. We have to keep the child in the hospital, rehydrate the child until the child is okay, and then after that we can discharge the child. We are not worried about the diarrhea. The stooling, and they're not what kills the child. What kills the child is the dehydration, is the shock. So as long as we are replacing what the child is losing, the child will be fine. So that's just that may take us a bit of a few days before we get there. Yeah. Okay, Instagram people, Major Evans, your daughter is weighing 20 kilos. She's 3 years, 10 months old. We just came back from hospital. That weight is a little bit on the high side. An average 3-year-old should weigh 14 kilos. Your child is almost 4 years old, so it should weigh 16 kilos. So your child is overweight, but definitely not as bad as 23 kilos at 3 years. But we should be careful with our children. Let's reduce all these, our pastries and the biscuits and all those the men we're giving the children. It's not good for their health. And let's ensure our children are active. I know these days with all these, our children are on their tablets, they are watching Cartoon Africa, Cartoon Network non-stop. No, we need to stop that. In our days, we all go out, go and play 10-10, you go and play football. Let's encourage the children to do a lot of activities. And I know somebody was calling out the teachers the other day, but I actually agree with that message. Please, teachers, stop giving these children unnecessary homework so that they start down in classroom all day from 8 to 2 or 3 or 4, then they come back again, they are still sitting down writing homework. When are they going to run around? When are they going to play, And then parents, we also give them tablets, we give them cartoons, Let's just reduce that. Let's let the children be active. Let them run around. Let them play 10-10, all those things that will make them burn the energy. Unless you want them to go do some dancing, whatever. But let's not let them be sitting watching. Let's reduce the screen time to less than an hour or 2 max, okay? And let's reduce the treats. Let the treats be once a week. Let it be just, so those are the things that make our children to have the weight. So let's work on that. I'm not sure I agree with the PID, but that is me. We may disagree. I guess I don't know what your PID sub, but definitely your dad is overweight for me. But obviously, like I said, it's not like I'm going to worry about it so much, but I'm going to give you advice that I've given to keep her active and reduce any unnecessary. Let them eat healthy. Okay, gifted a B 10.6 at 17 months. That is good. The weight is fine. An average 18 months old weigh 11 kg. Your baby is 10.6, so just appropriate. So what do you mean the weight is still not adding up? The weight is fine. The weight is okay. All right, thank you so much. I think I need to go. Today has been a longest day. I can't imagine that we've gone almost 20 minutes over the time, but it's okay. Thank you so much for those of you who are joined. I just want to make sure I answer all the questions that have come in. If you still have any questions, feel free to head over to our Facebook group, Ask the Pediatrician Facebook group. You can't miss us on Facebook. Just put Ask the Pediatricians, you will see us there. We don't do question and answer on Instagram, for the way Instagram is structured, it's not very appropriate for the kind of work we do. So Facebook is our main platform for answering questions. And if you want to read on any of these topics I've spoken about, breastfeeding, immunization, there's hardly any of these topics that we don't have an article, even developmental milestones, all the crawling, the walking, they are available on our website, www.axipediatricians.com, or our YouTube channel. We've talked about each of these topics on its own, like a teaching, or even our podcast. So just go, like somebody was asking about the crying babies. There's actually a podcast on crying babies. I've not really been doing new podcasts because I felt we've talked about them so many times and they are still there. Just feel free to go over to our podcast. Is available on all the podcast channels, Spotify, Amazon Music, Google Podcasts. Just type Dr. Gbemi ATP podcast, it will come to you. Or you can watch our YouTube channel. All the issues are on my back. I think you can see all the links there. Just search for us and follow us. You can learn more. But if you have any questions afterwards, go to our Facebook group, put your questions there. We are there 24 hours, 6 days a week. Mondays to Saturdays, we will answer your questions. Thank you so much for joining me. I really appreciate you. Have a wonderful, wonderful rest of your day. And it is bye-bye from me. Bye. Okay, I'm just going to leave with the screenshot of our social media platform so that you can see it. And if you want to, okay, I don't have it here. All right, no worries. Next time I'll try and make sure I have it. All right, good night. Bye.